It is the smallest device ever approved by the FDA. It's called the Eye Stint, and you can get it here at the Johnson City Eye Clinic, and Dr. James Battle is here today to talk to us about it. Give us just a general overview of what the Eye Stint is.
Eye Stint is part of a new class of surgeries for glaucoma called MIGS, or minimally invasive glaucoma surgery. The Eye Stint is approximately 1 millimeter in size. It's made of titanium, so it won't set off any metal detectors or interfere with MRIs, but it helps with control of eye pressure. We have to implant it at the time of cataract surgery right now, and it takes about 5 minutes or so on top of cataract surgery, right, and is a relatively very low-risk procedure.
And when the Eye Stint is actually in place, you can't even feel it.
That is correct. It's inside the eye. It's meant to be there for the rest of the patient's days. And it's very, very, very unusual to have to remove one.
Talk to us about the benefits of having the Eye Stint placed in your eye.
The Eye Stint helps to lower eye pressure for the treatment of glaucoma. Glaucoma is a neurodegenerative disorder that can lead to blindness if it's not controlled. Right now, our only way of treating glaucoma is by lowering eye pressure, and we have a lot of different ways of doing that. Including drops and laser treatments and also more invasive surgeries. But like I say, the Eye Stint is what we call a minimally invasive surgery. It's relatively low risk to the patient with some potential benefit for helping lower the pressure to, most importantly, control the glaucoma, but possibly even reduce their dependence upon eye drops for lowering the pressure.
Now, is the Eye Stint something that will remain with the patient for the rest of their lives, or is it removed later on?
It's with them for the rest of their days, similar to the implanted lens as part of cataract surgery.
And also, I was doing some research on this, and it helps with patients, you know, the eye drops that they have to do and everything. It cuts down on the amount and the severity of the amount of eye drops and other medications that they have to have.
Very frequently, that's correct. Our primary goal with treating glaucoma is to keep the pressure down, so whatever it takes to get that pressure down so we can slow or halt the loss of vision for the patient. But if things do really well with the surgery, sometimes we can reduce the number of medications a patient needs to control their glaucoma.
When you look at the ones you've done so far, the Eye Stints, how have been the results that you've seen?
Very good. It's an excellent procedure for lowering eye pressure. Most importantly, is low risk to the patient for hurting them or causing a problem. A routine cataract surgery by itself has more risk than implanting the Eye Stint.
Is this something that is only available here at Johnson City Eye Clinic, or is it?
It's available across the United States. However, not every center does Eye Stints. It's not a real common procedure yet, but from what the company told me, I'm one of the big implanters in Tennessee right now.
All right, so you have a lot of experience in doing this.
Yes, last time I looked at my records, I've done over 200. I think it's getting close to 250 over the past couple of years. And
so you encourage folks, if they've got glaucoma or they need a cataract surgery, this is something you really encourage them to do.
Absolutely. It's like I say, it's a low-risk procedure, potential for helping the patient control their glaucoma, maybe even come off some drops. In my opinion, it's almost a no-brainer.
All right. Dr. James Battle, thank you for being with us today. It is the Eye Stint. It can help save vision down the line, and it's here at the Johnson City Eye Clinic.